Thank you very much. I'm honored to be here. So I'm going to tell a personal story which has colored who I am and how I feel about compounded bioidentical hormone replacement therapy. I prescribe bioidentical hormone replacement therapy, and I am a 15-year user of bioidentical hormones. As fate would have it, I am one of the 20% of women who experience severe menopausal symptoms. I had hot flashes, palpitations, tinnitus, insomnia, irritability, urinary frequency, vaginal dryness, painful sex, headaches, joint pains, and I couldn't concentrate on any mental activity for longer than 2 hours. This began a few years after the 2002 Women's Health Initiative press release that HRT increased the risk of breast cancer, heart attack, stroke, and thromboembolism, and during a time when 5 of my friends were being diagnosed with breast cancer. They had never used HRT. I, too, during this time, had a breast lump that wasn't cancer. I entered menopause amidst a prevailing climate of fear. Physicians were afraid to prescribe HRT, and most women were afraid to use it. However, my pain and suffering outweighed the risk of HRT. Despite my fears, I asked my gynecologist to prescribe, which would then have been synthetic HRT, which would have been Prempro since I had an intact uterus. He refused because I'd had the breast lump. And based on the Women's Health Initiative findings, he thought HRT increased my chances of getting breast cancer. Instead, excuse me, he offered me Prozac and said I could live with my symptoms. I estimated that I would need a handful of medications to live with my symptoms. How long would this go on, I wondered? My aunt, who was 80, was still having hot flashes, and women in my family lived well into their 80s and 90s. Enduring my state for 30 years or longer was unimaginable. I called a compounding pharmacist who assisted me with bioidentical hormone dosing. Magically, in less than a month, all of my symptoms were gone. Were my symptoms gone forever? I found out recently. Over the most recent Labor Day holiday, I accidentally ran out of my hormones. In that short time, my headaches and joint pains returned, and it felt like an ice pick penetrated my left eye and exited the back of my brain. I'm miserable and intolerable without my hormones. I can't live without them. I am the face of a postmenopausal woman who uses bioidentical hormone replacement therapy. Before prescribing BHRT to my patients, I wanted to be sure, at least reasonably, that it was safe. I combed the literature and I found a large Danish observational study of 698,098 women, followed from 1995 to 2001, which was published in the European Heart Journal in 2008. It examined the outcome of various regimens: estrogen only, cyclic combined, long cycle combined, and continuous combined estrogen and progestogen, as they call it. They also used tibolone and raloxifene. They used 3 delivery routes: oral, transdermal, and intravaginal, in various combinations. They varied the hormone doses, and also the duration of hormone therapy was different, and they monitored the age because they had a national registry. The Danish don't use conjugated equine estrogen. The Danish study found a lower risk of heart attacks with a cyclic combined regimen of estrogen and progestogen, which gives monthly bleeding. The vaginal route reduced heart attacks by 44%, and the transdermal reduced heart attacks by 38%. The lead researcher of the Danish study, Dr. Ellen Lockgaard, concluded, and I quote, that when hormone therapy is indicated for a woman, a cyclic combined regimen should be preferred, and that application via the skin or the vagina is associated with a decreased risk of myocardial infarction, end quote. She also stated they have no reason to believe that these recommendations increase the risk of other diseases influenced by hormone therapy, such as breast cancer, venous thromboembolism, and stroke. Actually, we believe they could reduce the risk, end quote. The constant combined regimen of estrogen and progestogen increased the risk of heart attack by 35%, similar to the Women's Health Initiative. I am reasonably confident that rhythmically dosed cyclic BHRT with a monthly bleed is the way to go. I see menopause as an estrogen deficiency state, which should be treated as we would any other hormone deficiency state. For instance, in the same way we replace thyroid hormone for hypothyroidism or insulin for type 1 diabetes. I am a strong advocate of BHRT.